look at it, the first angioplasty was done when I was born way back in 1977. But the primary PCA program, that is what I mean by primary PCA, is doing an angioplasty at the time of having a heart attack. That is what we call as a primary PCA. So a primary PCA first time in the world was done way back in 1994. So that was first started in Arizona. It was probably the first experience with primary PCA. But since then, in the last 30 years, obviously primary PCA has emerged as the treatment of first choice in patients presenting with a heart attack. So this is something which is there for the last 30 years as the treatment of choice. But if you look at NIC data, that is National Interventional Council data, except for the state of Kerala, all other states average somewhere between 5 to 12% in terms of number of cases receiving primary PCA. That means 30 years back it was established that primary PCA is the best treatment. Despite being established as the best treatment, in India, last year's data clearly suggests not many places across, I know the healthcare spectrum across the country is, there's a lot of disparity, but across the country, if you look at it, the number of people receiving primary PCA has always been low. So primary PCA, despite its advantages in terms of mortality and morbidity outcomes, has not been a very popular choice because of logistics, because of financial issues, social issues, and multiple issues. So when we come here in this forum and talk about our achievements on primary PCA, it makes me very happy that we have been able to address patients who are presented with complex scenarios, cardiogenic shock, and patients who have come really sick and then walked home just because we were able to offer primary PCA to them in time. So here, since we have a robust system starting from the ambulance service to the ER to the cath lab, everything seems to operate in a very seamless fashion. So one phone call away and then everything seems to fall in place. We have a very nice STEMI alert program in our institution where the moment somebody activates that pathway, everybody in the system kind of prepares for it. So right from the time, say in a peripheral hospital, somebody sees an ECG, detects the ST elevation MI, they give us a call, so that once that pathway is activated, it is very seamless, because I have worked in previous institutions and I know the challenges that happens. So many logistical challenges, so many social issues, and the largest publication of time in primary PCA comes from another institute in Chennai, which has the largest data of number of primary PCAs done, and the average time taken for the procedure to be done is close to 120 minutes and more. And the international standard expected is the door to balloon time should be less than 90 minutes. So why we are gathered here and we are proudly presenting our numbers is, in the last month, the data that my colleague Dr. Sundar will be sharing is our average time taken has been less than hour, around 49 minutes. So that is why we feel very happy and proud that in the last year or so since we have been in this institution, the seamless way that primary PCA program has activated, a lot of factors have contributed in terms of the location of the institution, the management support, and in general awareness about heart disease, which has helped us achieve this. And here now request my colleague Dr. Sundar to share a few cases and scenarios which will highlight how this program works and how things have improved over the last year in this institution. Thank you.